Voyeuristic disorder represents a significant paraphilic condition characterized by recurring, intense sexual arousal from observing unsuspecting individuals who are naked, disrobing, or engaging in sexual activity. According to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, this disorder requires that these fantasies, urges, or behaviors cause clinically significant distress or impairment in social, occupational, or other important areas of functioning, or that the individual has acted on these urges with non-consenting persons over a period of at least 6 months. The clinical understanding of voyeuristic disorder has undergone substantial evolution throughout psychiatric history. Early theoretical frameworks primarily relied on psychoanalytic interpretations that viewed voyeuristic behavior as stemming from unresolved childhood conflicts or arrested psychosexual development. Contemporary approaches have moved toward more comprehensive biopsychosocial models that recognize the complex interplay of neurobiological vulnerabilities, psychological factors, social learning experiences, and environmental triggers that contribute to the development and maintenance of this condition. Individuals with voyeuristic disorder typically experience sexual excitement from secretly observing others in private moments without their knowledge or consent. The arousal is derived not only from the visual stimulation but also from the secretive nature of the observation and the sense of power or control over the situation. This behavior differs significantly from consensual activities such as watching pornography or engaging in agreed-upon sexual observation with willing partners, as the lack of consent from the observed individual is a crucial element of the disorder. The onset of voyeuristic disorder commonly occurs during adolescence, with many individuals reporting their first voyeuristic urges during their teenage years. Research indicates a significant gender disparity, with males representing the vast majority of diagnosed cases, though female cases do exist and may be underreported due to societal expectations and different manifestation patterns. The condition often follows a chronic course, with episodic intensification during periods of stress, relationship difficulties, or other psychological challenges. Neurobiological research has begun to reveal potential brain mechanisms underlying voyeuristic disorder. Studies suggest alterations in neurotransmitter systems, particularly those involving serotonin, dopamine, and norepinephrine, which play crucial roles in impulse control, reward processing, and sexual behavior regulation. Neuroimaging investigations have identified differences in brain regions associated with impulse control, risk assessment, and sexual arousal, including the prefrontal cortex and limbic structures, though more research is needed to establish definitive causal relationships. The psychological profile of individuals with voyeuristic disorder reveals several common characteristics that inform clinical understanding. Many exhibit social anxiety, interpersonal difficulties, and challenges with intimacy in consensual relationships. Some research suggests that voyeuristic behavior may serve as a maladaptive coping mechanism for underlying emotional issues such as depression, low self-esteem, or feelings of powerlessness. The temporary excitement and sense of control experienced during voyeuristic acts may provide relief from chronic feelings of inadequacy or social rejection. Assessment of voyeuristic disorder requires specialized clinical evaluation by experienced mental health professionals. The diagnostic process involves comprehensive interviews exploring the individual's sexual history, the nature and frequency of voyeuristic urges and behaviors, and their impact on daily functioning and relationships. Clinicians must carefully distinguish between true voyeuristic disorder and other conditions that might involve inappropriate observation, such as substance-induced behavior, manic episodes, or certain personality disorders. Modern technology has significantly complicated the landscape of voyeuristic behavior, with digital cameras, smartphones, and internet capabilities creating new opportunities for voyeuristic activities. Cybervoyeurism, including unauthorized recording and distribution of intimate images, has become increasingly prevalent and presents unique clinical and legal challenges. These technological aspects require specialized understanding and intervention approaches that address both traditional voyeuristic urges and their digital manifestations. Treatment approaches for voyeuristic disorder primarily utilize evidence-based psychological interventions. Cognitive behavioral therapy forms the cornerstone of most treatment programs, helping individuals identify triggers for voyeuristic urges, develop alternative coping strategies, and modify distorted thought patterns that contribute to the behavior. Specific techniques include cognitive restructuring to address beliefs that justify voyeuristic behavior, behavioral interventions to reduce urges, and relapse prevention strategies to maintain treatment gains. Acceptance and commitment therapy has demonstrated effectiveness in treating voyeuristic disorder by helping individuals accept their urges while committing to behaviors that align with their values and respect others' rights. This approach emphasizes mindfulness techniques and psychological flexibility, enabling individuals to experience urges without automatically acting on them. The therapy focuses on developing meaningful life goals and healthy relationships that provide more sustainable sources of fulfillment than voyeuristic behaviors. Group therapy can provide valuable peer support and reduce the isolation commonly experienced by individuals with voyeuristic disorder. Group settings allow participants to share experiences, learn from others who have successfully managed similar urges, and develop accountability systems. However, group therapy requires careful facilitation to ensure that discussions do not inadvertently provide ideas for new voyeuristic activities or normalize inappropriate behaviors. Pharmacological interventions may be considered as adjunctive treatments, particularly for individuals with high levels of sexual preoccupation or those struggling to control their urges despite psychological interventions. Selective serotonin reuptake inhibitors, SSRIs, can help reduce obsessive thoughts and compulsive behaviors related to voyeurism. In severe cases, antiandrogen medications that reduce testosterone levels may be prescribed to decrease overall sexual drive, though these require careful medical monitoring due to potential side effects. The legal implications of voyeuristic disorder are substantial, as the behavior typically violates privacy laws and constitutes criminal activity in most jurisdictions. Individuals with this condition may face charges related to invasion of privacy, illegal surveillance, or creation and distribution of intimate images without consent. The legal consequences can include criminal penalties, civil liability, registration requirements, and various restrictions that significantly impact their lives and relationships. Family and relationship dynamics are profoundly affected by voyeuristic disorder. Partners and family members often experience feelings of betrayal, violation, and confusion when learning about the condition. They may struggle with trust issues and worry about their own privacy and safety. Family therapy can help address these concerns and develop supportive approaches that encourage treatment while maintaining appropriate boundaries and safety measures. Prevention efforts for voyeuristic disorder emphasize early identification and intervention, particularly during adolescence when problematic patterns may first emerge. Educational programs that promote respect for privacy and consent, healthy sexuality education, and emotional regulation skills may help prevent the development of voyeuristic behaviors. Additionally, accessible mental health services for individuals experiencing concerning urges can provide crucial early intervention opportunities. Contemporary research into voyeuristic disorder continues to explore new understanding of brain function, genetic factors, and more effective treatment approaches. Virtual reality therapy is being investigated as a potential tool for helping individuals practice impulse control and develop empathy for potential victims. Neuroimaging studies may provide insights into brain changes associated with successful treatment, potentially leading to more targeted and effective interventions. The societal response to voyeuristic disorder often involves significant stigma and misunderstanding, which can prevent individuals from seeking help and increase their risk of reoffending. Public education efforts aim to increase understanding of the condition as a treatable mental health issue while maintaining clear boundaries about the unacceptability of voyeuristic behavior. This balanced perspective is essential for encouraging individuals to seek help while protecting potential victims. Looking forward, the field continues to emphasize comprehensive, evidence-based treatment approaches that address both the voyeuristic behaviors and underlying psychological factors. Success requires collaboration between mental health professionals, legal systems, technology companies, and communities to create effective approaches that protect privacy rights while providing appropriate treatment for individuals struggling with this challenging condition.